Okay, our next presenter is going to be Dr. West.
Dr. West is our last presenter.
Okay. Dr. West, health scientist, infectious disease readiness and innovation, and the National Center for Emerging and Zoonotic Infectious Disease. We'll be sharing valuable insights on building wastewater surveillance in tribal communities and strengthen public health. Let's give her our full attention as we delve into this important topic.
Good afternoon, everyone, and thank you so much to the committee for the opportunity to present to you today. I'm really excited to speak with all of you about wastewater surveillance this afternoon.
I'm sorry, I'm going to ask you to move, just so we're having difficulty hearing. Maybe if you move the microphone just a little bit. I want to make sure that folks can hear you.
Is this a little better?
A little.
Okay, maybe just try to project.
Yeah.
Okay.
Thank you. Appreciate that.
So I want to also introduce my branch chief, Nicole Fehrenbach, and we work in the Rapid Response Research and Surveillance branch. And today I will be discussing our efforts so far, and I'm really eager to learn from all of the committee members on ways to build further wastewater surveillance with tribal communities in the future. Next slide, please. So first, I want to go over the foundations of wastewater surveillance for those of you who aren't quite as familiar with it. For those of you who are, it's just a little bit of a refresher. Next slide, please. So wastewater surveillance has been going on for decades, but in the domestic US, it's a rather new system. And when I speak about wastewater surveillance, what I'm really referring to is testing influent, untreated wastewater for markers of disease, typically pathogens, to best understand disease transmission within a community. And so very simply put, we're looking at this influent, untreated water to look at those markers so we can get data in a timely way so that the communities can act quickly to prevent disease spread. Next slide, please. Now, what that really comes down to is an individual's contribution to a sewer line. And that's where all of this starts. It begins in our communities. And once the individual flushes their toilet, that enters the sewer system, and that becomes our untreated influent. At a centralized treatment plant or other sampling point, that untreated influent is then taken. And this is by our amazing partners at utilities who have been with us throughout the history of the National Wastewater Surveillance System. And they take these samples that are then sent to a lab. That lab can then process those untreated samples to concentrate the marker and extract the markers of those pathogens. Typically, that's genomic material, usually DNA or RNA, and then that can be amplified and detected. All of that gives us that raw data that we receive, analyze, and visualize. And all of this on average from the time that someone flushes their toilet to the time we have data in hand is about 7 days. So that goes to inform metrics about disease transmission in a community so that it can best inform public health decisions in a really timely way. Next slide, please. So this timeliness is one of the opportunities that wastewater surveillance presents, but there are many other opportunities that we've found throughout the history of wastewater surveillance in the US. And one of those is that this single sample can collect infection status information on hundreds to millions of community members. As long as someone is contributing to that sewer line, which is a term we call a sewer shed, that's the community that's contributing. If they're in that community, then we can capture that infection status. And again, that's with a single sample. So this is a really nice literal and figurative bang for your buck. It helps us to better understand disease trends in a community, and this is independent of healthcare seeking behavior. So whether or not someone is able to seek healthcare, or maybe they don't know that they're sick, their symptoms are mild, we're able to still capture those markers of infection. And not only can we capture the infection status of multiple individuals, but also within a single sample, we can look for multiple disease targets. And this is because wastewater is such a rich sample, but that also offers a flexibility for our communities if they have priorities in disease trends that they want to monitor. Now, of course, there are limitations to this system. We're not able to include septic systems or decentralized wastewater treatment facilities. And now this has a special implication for more rural or remote communities that tend to rely on these systems. Wastewater surveillance also can't be used to clear a community. So a negative result doesn't necessarily mean that there's absolutely no disease transmission. It just means that perhaps this is below the limit of detection in that sample. What it can tell us, though, is about transmission levels, and over time, we can understand what those negative results mean, and perhaps it can indicate very, very low disease transmission. And finally, for every pathogen that can be monitored within wastewater surveillance, we do need data to understand the best metrics to express that data and to translate it to public health action. So in other words, for every pathogen we're looking at, we need data to make better data in the future. Next slide, please. All of these opportunities with these limitations have still resulted in a system that allows us to inform timely public health action. And we found throughout the COVID-19 pandemic and other outbreaks that wastewater data can provide information on rising levels of infection in a community days before this can be detected by other metrics, such as hospitalizations. And those days of advance notice for our communities have resulted in COVID-19 public health interventions, vaccination campaigns, better allocation of resources to the communities that most need them, particularly when testing access might be limited or metrics might be changing. In addition, it helps to better inform communications surrounding new variants and their spread. And this has been valuable for many of our communities with COVID-19 to better understand really what's going on in their community and how this might impact clinical outcomes. With MPOX, we've also been monitoring for that, and detections have similarly been used to understand the emergence and sometimes reemergence of MPOX within a community, particularly for our community's interactions with clinicians. This has been very important to notify them early, to look for the symptoms that are associated with MPOX, and also to communicate with community members about these detections. Next slide, please. So all of this to say, wastewater surveillance is particularly valuable because it offers an additional perspective on community health. Wastewater samples capture this community level data to understand changes in disease transmission, regardless of an individual's ability to seek health care. In addition, the wastewater sample itself is a flexible testing matrix. You can look for multiple different pathogens or targets according to community public health needs. And finally, it provides timely data that can be used to enhance public health action in all of our different communities. That has been one of the most valuable aspects of wastewater surveillance, is that timeliness. Next slide, please. So now I'd like to go a bit into the National Wastewater Surveillance System infrastructure, which is the program that I work in. Next slide, please. So the National Wastewater Surveillance System, or NEWS for short, was born out of the COVID-19 pandemic in 2020. And since that time, we've grown to over 1,500 sites throughout the US, its territories, and tribal lands. And the image here shows our sampling sites. Those in coral are those that are testing and contributing data for SARS-CoV-2, and those in teal are SARS-CoV-2 and MPOX. These are sites for which we're receiving data in our secure data portal called Decipher. And from that portal, we're able to share data publicly on our dashboards. All of these sites are, the majority of them are led by our jurisdiction-led programs. So a state or other jurisdiction creates their own wastewater surveillance infrastructure and leads the development of that system in their community. But we also have up to 400 sites at any given time that are participating in a testing contract. And this provides twice weekly sampling and testing at the participating sites. And this is particularly useful for sites that may not be eligible for our more traditional funding mechanisms. I say traditional, we're a very young system, particularly when in reference to other surveillance systems within CDC, but we're really grateful for all of our participants, and we're still eager to learn more and better ways of developing. And through that, we have our 4 centers of excellence in California, Colorado, Houston, and Wisconsin, which provide regional guidance to our jurisdictions, but also guidance back to us of successes and obstacles so that we can better adapt. Next slide, please. Another way that we're looking to grow as a program is through expanding the pathogens that we're looking for in wastewater. As I mentioned, it's a very flexible testing matrix, and in 2023, we first began to prioritize testing for influenza and respiratory syncytial virus, or RSV, as we were hitting respiratory virus season and wanted to prepare our sites as much as we could. We're also evaluating new targets and assays, and in 2023, we worked on enhanced data visualization so that the data that we were sharing publicly made sense and was accessible to the public. This was after really extensive feedback from our public partners that we really appreciated. And now this year, we're really working to focus on validation, piloting, and rollout of new targets. So this is what we'd like to refer to as our expanded core panel. And so in addition to SARS-CoV-2, Mpox, and those respiratory viruses, we're also looking at additional targets such as West Nile virus, norovirus, and antibiotic resistance genes. Hopefully later this year, after careful validation and piloting with our centers of excellence, we'll be able to roll that out system-wide to all of our partners so that they may also look for those targets depending on their community's needs. Next slide, please. Throughout the history of news, our engagement with tribal communities has really evolved. Primarily, we want to best serve tribal communities by learning about each community's unique needs and capacity for wastewater surveillance. And through that work, developing government-to-government relationships so that we can get them the data that they need and support them as much as we can. We've had two primary mechanisms of doing that so far. And the first was the news testing contract that I mentioned earlier. This provided twice weekly testing, and at first in 2021, it really focused on SARS-CoV-2, and this provided real-time data directly back to the tribes. One thing that we prioritize when working with tribes is that the data goes directly to that contributing community, not to neighboring jurisdictions without the tribe's explicit consent. They also have access to our secure data portal, which provides that data in real time. As soon as we have the data, it goes through quality checks, and within minutes, it's available. Through the contract and any work with news, we also offer engagement with the news community, and that includes our communities of practice, which are led with health departments, labs, and utilities to just collaboratively learn and share successes and also learn updates from news. In 2022, we were really excited to start work with the 1803 Cooperative Agreement with the Office of Tribal Affairs and Strategic Alliances. And we had a single recipient that year who was working on education and communication campaigns. And in 2023, we expanded that now to 5 recipients who are working on really diverse projects, from those education campaigns to directly supporting their utilities. Our colleagues at the Turtle Mountain Band are working to directly support their utilities who have walked through feet of snow to get twice weekly samples for years. And that work began before we were able to start supporting that tribe. And we're just so grateful to be able to support that work now. In 2022 and 2023, we also expanded those targets within the testing contract. And now in 2024, that contract is still ongoing. And we're looking forward to working with more tribal communities in the future. Next slide, please. So through all of those relationships and mechanisms that we've been using, there are a lot of different factors that contribute to the success of these systems. And some of those are infrastructure and logistics. So what is the available infrastructure in a community? What are their data needs? What are their data protection needs, importantly? And what communication styles are preferred? Who should we have at the table from the very beginning, from utilities to tribal leadership? Who should we include and regularly include, as well as tribal community members? But at the core of all this work is to earn and maintain trust. And how we do that is informed by each community's history and their current needs. And so that relationship building and respect for sovereignty is really just the foundation upon which we want to build any new relationship with tribes. So far, throughout the history of news, we've really worked to go directly to a tribe, usually reaching out to their utility or their health services department, so that we can then learn who their trusted partners are. And then based on that, know how to leverage any networks that may exist, but also respect those boundaries that they've shared with us so that we can best understand who to share data with, who should have access to the data, and who should have input on this surveillance system. Along those lines are data protections. We know that data sovereignty is incredibly important for tribal communities. And so we really work with each community to understand their boundaries and comfort and how we can best support them through our existing data protections. And if we don't have an existing data protection, how we might be able to support a new one. Through all of this, we have ongoing conversations with communities. We want to learn successes and challenges in real time so that we can best support them and make sure that their data is timely and effective for their community. Next slide, please. So now I'd like to focus a bit more on our future work to better support tribal communities' public health with wastewater surveillance. Next slide, please. So I mentioned earlier some opportunities and limitations of wastewater surveillance as a field, but in tribal communities, I wanted to further contextualize this. So we still find that the opportunity for community level surveillance is incredible and that you can capture many individuals with a single sample, and you can also capture multiple pathogens in that single sample. Along those lines, we're very open to creative sampling and testing methods. We grew out of the COVID-19 pandemic. We're used to creativity alongside our science, and we want to work with communities to understand what works best for them, whether that's a sampling type or frequency or a testing system. We want to meet them exactly where they are. Using all of those methods, we want to help support translating wastewater data into public health action. Many of the committee members have shared that tribal communities know their communities best, particularly tribal leaders, the tribal health services, and our utility partners are invested in public health. And so how do we get all of them at the table so that we can translate these wastewater data into public health action so that we can effectively serve their communities? Now, there are, of course, challenges. Current funding mechanisms, that's something that we've heard a lot about, and I've really valued the input so far in the past 2 days. But our current funding mechanisms are fairly limited, and we want to learn more about preferred funding mechanisms for tribes. We also acknowledge that there are hard to reach communities that are served primarily by septic systems or those decentralized systems. And we can still work creatively to find alternates if a community still wants to participate in wastewater surveillance, but that is a challenge for us that we want to acknowledge. That goes hand in hand with resource considerations, and that goes from everything from money to time of the utility workers, to staff that are available to analyze these data. We want to be respectful of the capacity of the community and not just impose a system, but really learn how we can best integrate into existing systems and build up those that are already working well. Outreach and relationship building is somewhere where we'd really like to learn more about how to reach tribes directly and build those relationships and make ourselves accessible to tribes so that they know who to reach out to about wastewater surveillance if they're already doing it or if they're interested, how we can best reach out to them. And then finally, but very importantly, data use and data protections. What can we do from the CDC side to protect the data to the extent that we are able to? How can we be transparent about those opportunities? And how can we work with tribes to build up data protections that work for them? Next slide, please. So all of this informs our future efforts. One item that we'd really like to learn more about is ongoing wastewater surveillance efforts. News is one effort in wastewater surveillance through the country, but we know that tribes have ongoing wastewater surveillance systems that they've been working on for years. We'd love to learn more about them, about their successes, about how they've creatively built those, and also their challenges. We also want to identify new mechanisms of support for wastewater surveillance in tribal communities. That's primarily funding, but also technical support. How can we make that best available to these communities? And then to continue to improve our internal processes so that they work well for tribes. If there are barriers to entry, we want to know about them. If it's our data platform, if it's our communication, or even the language we use around wastewater surveillance, how can we use the incredible knowledge of our tribal partners to better improve our processes? And finally, to prioritize and integrate ethics into wastewater surveillance practices. We're a fairly young surveillance system, but that gives us an amazing opportunity to put ethics at every element of our surveillance system early on. And that will be iterative. We know that over time, technology can change, science can change, and priorities can change. So how do we make this a living ethical framework that we can base our work on, and how can our tribal partners help inform that? Next slide, please. So today, I really value the chance to learn from all of you, and these are our goals for learning from you. And I realize these are several questions. I'm very open to any other questions that you might have, but particularly we'd like to focus on ways to encourage participation by tribes in wastewater surveillance. That might not necessarily be with news, but if it is, that's wonderful. How we can seek partnerships with tribes, particularly around technical challenges and find solutions in more remote environments. How do we communicate wastewater surveillance findings best? And how do we translate this into public health action? And then particularly considerations around data protection and sharing considerations. We know that this will likely be different with each community, but if there are best practices that we are not already doing, we want to learn about those. And finally, to learn about news targets and priority pathogens for monitoring in wastewater surveillance. Wastewater surveillance is a really rich sample, and we are able to look for many different targets and markers of disease, but we want that also to be informed by our communities. So beyond that expanded core panel, what would be most useful? Are there natural disaster panels that would be of interest? Are there panels that would focus on climate change that would be of interest and diseases that are associated with that? So all of this to say, I hope to learn more from all of you, and thank you so much again for the opportunity to present to you today.
Thank you, Dr. West. Thank you for delivering such an insightful presentation on building wastewater surveillance with tribal communities to strengthen public health. So I will open the floor for discussion or questions from all the TAC members. Yes, Ms. Freeman.
Thank you, Ms. Barker. Carrie Freeman, Tribal at-Large member. I've had the opportunity to get to sit with Rachel the past couple of days for lunch. And I posed a very interesting question, and based on your fantastic, all this information that you've given us, there's a very interesting idea that we floated during lunch today about the implications of monitoring for other things other than pathogens, specifically increasing opioid use in communities, and especially communities that take ownership of their own wastewater surveillance. We had conversations about ethical implications and potentially using or having punitive types of situations happening if it's on a broader scale. In this TAC committee, we've talked a lot about data use specifically. So if the tribe is able to monitor specifically for increasing opioid use in their communities, they own that data. They don't necessarily have to share it. So it wouldn't be put out into a broader audience for punitive types of issues. But I feel like it could impact counteractive measures on community outreach if you're noticing spikes in usage in your community, potentially heading off overdoses in a community, expansion of counteractive measures like Narcan, increasing education for communities. So would your department or program be able to work with tribes on, training, technical assistance in, starting these types of surveillance in their communities? Thank you.
Thank you for that question. And that's something even beyond illicit substances, but any disease that might have stigma associated, being mindful of that when designing the testing program and designing the data sharing. So short answer to your question, yes, we would absolutely be happy to work with tribes in a way that they're comfortable so that they are leading their wastewater surveillance in their community for priority markers such as opioids or emerging illicit substances. Now, that is somewhere where I would want to bring in our colleagues from the Division of Overdose Prevention, who have been really valuable partners so far. because the science of opioid and wastewater surveillance has a long history, but we still want to understand what the most valuable metrics would be for that. So if we're getting that data in for a community and we're getting it in a timely way, which would be so valuable, what exactly are the metrics that are most valuable in that public health action and allocation of resources, even in justification for need of more resources to show in real time what's happening in a community? And what metrics potentially might not be so helpful, and metrics that maybe you don't need to spend as much time on. So that's something that we understand that, and we want to learn more about how illicit substance abuse and overdoses are impacting tribal communities, because it is a public health issue and it's an opportunity for wastewater surveillance to provide support. But we do want to do that in a mindful way so that the data are used for public health good and not for stigma as best as we can. And a lot of that is probably definitely learning from tribal communities in who should be at the table, who should be getting that data, how should it be shared with the community, and how do we get community feedback on that as well.
Was there anyone else? Okay. Dr. Dolphin?
Yeah, I just want to thank you. I thought your presentation was fantastic. I really enjoyed learning about what you have in place for wastewater surveillance. And years ago, I had some work in the laboratory where we worked with large water samples and tried to concentrate them, and it was really challenging. So it's amazing to see what can be done now. My question is about data use agreements. You mentioned that right now, the groups that you work with, you're able to collect the data, you do a quality check, and then within a few minutes, you provide that data pretty much in real time to the recipients. If I heard you correctly, you said you do not share it unless you've been given permission from the tribes to share that data with others. Is that right?
Yes, that's correct.
So you've set up a model that we'd like to see carried out across other surveillance systems. I'm really interested in how you set up the data use agreements, and maybe perhaps we can talk about, with EZIT, how you did that, because others are interested in doing the same. And you seem to have been able to do that successfully. So it'd be great to be able to share sort of your model with others across the agency. And maybe you've already done that. This is just the first I'm hearing of it. So thank you.
Well, thank you for that comment, Dr. Dolphin. One of the things that coming from a background at the agency where I actually started in informatics back in 2005, one of the challenges that CDC has faced is the ability to share data back. And the amazing thing that the wastewater surveillance team did, almost I think without realizing it, because they hadn't been burdened by some of the history that the agency has, that they set up in their Decipher system immediately from the get-go that states, tribes, counties, cities that were submitting data have their own space where the information comes in, is analyzed and provided back in a summarized form so that they can do also their own analytics, as well as get information essentially real time. And then from all the jurisdictions and participants that we have those data use agreements that we are allowed to publish that information, we then visualize that in a aggregated way. And of course, protect whenever a jurisdiction only has a few cases or something, that we are very mindful of making sure that we are not exposing a jurisdiction to some information that they may not be comfortable having reported out. And so that's particularly true for our tribal partners who are engaged with us in this, and how they have chosen to enable us to share data or to not share data, but they still have access to all the information with the additional technical assistance that CDC can provide. And it's all behind multiple firewalls so that it is protected. It's a wonderful model, and we would love to be able to share it more broadly. It does take a bit of doing on the back end, when you open the hood, so to speak, that there is an investment that has to be made in the technical resources that can enable that to happen. But once you have those pipelines set up and those algorithms built, it can work relatively well with minimal, sort of ongoing maintenance and quality oversight. Thank you.
Thank you. Really great presentation. I appreciate it.
Dr. Stanfield?
Sharon Stanfield, Rep at Large. Thank you for the presentation. Do you work with a lot of tribes? I mean, do you have a lot of tribal partners?
So I'm proud to say that we work with 5 contract sites that serve tribal communities, and we have 5 recipients now through the cooperative agreement. And I realize that hearing from some of my colleagues in other divisions, that may seem like a small number, but I will say I am incredibly grateful to each and every community for that. But that is something that we are mindful of, that of our many sites, there are only 5 contributing data into that data platform that represent tribal communities, and that is a big gap. So that is one thing that we're working to improve upon, is how do we encourage participation in a way that's also respectful of their boundaries. And so, yes, that's the
Good.
number.
Sounds like you're off to a good start. Thank you very much. Appreciate your information.
Okay, if there's nothing else, I'm going to turn the meeting over to Dr. Dolphin. She's going to give us a summary of our TAG meeting.
Really great. Thank you. Appreciate it. Well, I think we've had a successful 2 days. We are about to close out another successful TAC meeting. So I want to start by just thanking all of our TAC members and technical advisors, your technical advisors who support you, for your thoughtful questions, comments, and recommendations. And I want to thank all of the presenters for really doing a fantastic job of not only presenting the information, but addressing questions and engaging in discussion and posing questions for us to consider as we move forward. I want to thank OTASA for all of the hard work they did in coordinating this meeting. Can we please give them a hand? We have a fantastic team who worked really put in tireless efforts to help make this a success. So I really thank our OTASA team and all the staff across our center who support these engagements, and thanking our facilities and AV staff too. So just thanks to everyone. We opened the discussion today with looking at an overview of our budget, and then we ended with wastewater surveillance. So we've had a variety of topics here today. We think we are working to make each meeting better and better. And so we appreciate our engagement with our TAC, and we want to continue to engage you through our monthly meetings with the co-chairs, through our monthly meetings with the TAC, to hear from you how we can make the most use of your time and really begin to put in some tactical measures to address some of the things we've learned. I think we're at a point now where we can set some clear goals and work together to try to accomplish them. So I feel we're in a really good place. I look forward to our next meeting and our next conversation. Look forward to seeing everyone in Oregon this summer. So our next meeting, we are moving back to Indian country and looking forward to that. And I want to give all of you thanks and wish you safe travels. And I think I will turn it back over to Legislator Barker to close us out.
Okay, Dr. Kilsback, did you have anything you want to say?
Yeah, thank you, Legislature Barker. So I just want to make sure, as a reminder, in your logistics email, we provided an update CIO guide. The resource offers comprehensive information about CIO, providing all the TAC members with electronic access to essential details that OTASA team can maintain. It includes the center director's names, contact information, points of contact, or organizational chart link, example priority areas, technical assistance services, budget updates, health equity initiatives, health equity data collection efforts, and endeavors to enhance tribal data infrastructure. We have received feedback from our TAC chair and the co-chair indicating that it would be beneficial to have this information available on the FTP site, where all uploaded meeting materials are located. Please note that We will consistently update the guide and share these updates with you via FTP site. To accommodate members who prefer printed copies, we have some copies available for TAC delegates who would like one. Please approach me or as a member of the OTASA team if you'd like to interested in receiving a printed copy. It is essential to remember this information is readily available on FTP site and will be regularly maintained there. Thank you. And lastly, please drop your name tags off at the table out front because so we can use them for future meetings. Thank you.
Thank you, Dr. Kills. Thank you, Captain Killsback. Everybody's a doctor around here, but anyway, sorry about that. I just want to remind everyone about our conference calls. We voted today on when our conference calls would be. I believe it was on the fourth Thursday from, this is Eastern time, from 4 to 5:30 Eastern time. So now they're going to be 90 minutes. So just remind all TAC members that if we don't have a quorum on those calls, sometimes we can't vote on important business that we need to take care of. So I just want to thank everyone for the dedication. It's not easy leaving home for a couple of days and coming to these meetings, but it is well worth it because we take so much information back to our tribes. But not only that, we give so much information to the CDC. And so that is our goal, is to be able to be great partners with them and to share information. What they give, we take. What we give, they take. And so we want to appreciate Dr. Dolphin and her team for everything they've done for us to be able to have this wonderful meeting. Look forward to meeting in Oregon and look forward to our calls. So safe travels for everyone going back. And I'm going to ask at this time, do we have a volunteer to close us out in prayer? Okay, if not, then I'll do it. So if you'll just bow your heads. Father God, we just want to give thanks for this day, Lord, and all the information that you shared with tribes, Father, and just all the information that we'll be able to take back. Father, as we travel home, we just ask that you watch over us and take us back to our families where we've been missing. Father, we just want to thank the CDC and everyone here who has opened our hearts and minds to the information. Just be with us, Father, as we continue to work hard for our tribal citizens, knowing, Father, that everything we do here on earth is to give glory to you. Now, Father God, just be with us as we go home. These things we ask in your Son's name. Amen. Okay, we're adjourned.